guys, welcome back to Medical Coding with Blue. Today's episode is all about how to prepare for the 2024 CCS or Certified Coding Specialist exam. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, the CCS exam with the American Health Information Management Association. Now I am talking about how to prepare for the 2024 edition of this test. If you are taking this CCS exam from now until, and today is January the 16th, if you are taking it anywhere from now until the end of April, you will be in the 2023 edition of this test. I am talking to people today who are taking their test May 1st and on, okay? May 1st, 2024 and on, okay? So this video is for you if you're preparing now. The test is going to go through a bit of a change. So I'm going to review the different domains of the exam and what their percentages are and how to prepare. And I'm going to talk about a couple of other things too. But I will say this. I did get a question from a viewer who asked that they're preparing for the CCS exam. They're going to be taking it later in the summer. And they wanted to know if they should get the 2023 CCS exam prep book or if they should get the 2024 CCS exam prep book. Guys, when it comes to these books and the different editions that come out, and it's really the same questions, but they just slap a different year on it. There are updates if there has been any code changes. Obviously, they will update those codes in the new edition. But majority of the information is going to be the same, if not the exact same thing. So to save yourself a few bucks and get the year before edition. I always say when it comes to working with older books, you can, when it comes to the workbooks, you can go up to 3 years back and it'll still be relatively the same. There will be updates. So you may have some questions where your answer looks different from the book, and then if you try to find the correct answer that the book says, it's not in your book, so then you know that code got updated, okay? But it's just to save yourself a few bucks. It's not necessary to get the latest and greatest edition when the year before is just as good and the same, basically. So that's my advice there. But my other bit of advice on that same hand is that I do not recommend the Ahima CCS exam prep book. Now, I am all the way with Ahima, and most people would say, Blue, I'm shocked. You shouldn't be shocked. I am a YouTube content creator about medical coding. I have the CCS credential myself, and I'm the one who gets the emails from people upset after they get done with their test or CCS exam. They are very upset. They write to me and say none of those questions were on that exam that they have in the prep book. And I have to be the one to explain to them that, and I'm going to explain this to you as well if you're not sure. The questions that are in the CCS exam prep book by Ahima are not the same questions that are on the exam. I'm going to say that again. The questions that are in the CCS exam prep book from Ahima are not the same questions that are on the Ahima CCS exam when you go in to go take your exam at Pearson VUE. These are not the same questions. So I tell people don't get that book only because of the simple fact that people have relied on this book, and even I have the book. I don't like the way that the book is set up. I don't like the setup of the questions either, okay? So what I will say is this. When it comes to getting yourself a practice for practicing for the test, you can't really prepare from the guides that are out there, okay? Even other guides, you can't really prepare with those. I mean, Medical Coding Pro is pretty good. Their books are pretty good. I use their books to prepare for the CCSP. But it's not always going to be the best fit, especially for the CCS. The CCS has so much to this exam. We don't know how many questions are going to be on that exam until we get into the exam room, because that's the way Ahima has it set up. It's always going to be a range of questions, okay? So, like I said, we're going to go over these domains here in a minute. But what I recommend, instead of trying to rely on this exam prep book, and if I do good on this exam prep book, then I'm going to pass the exam for sure. Wrong, okay? You're already setting yourself up to fail because you're depending on this book to give you that confidence. When the confidence actually comes from practicing, looking up the codes, going through scenarios, getting a list of procedures to look up, and actually taking the time to practice and look up the codes. A lot of people don't want to do this. They want to do the shortcuts. What is a shortcut? How do I get there? And what exactly do I need to know? We don't know. Everybody has a different test when they go in to take the CCS. So no two tests are the same. Ahima does that to protect the integrity of these exams, because otherwise then anybody could pass these tests. These are very rigorous tests. This is considered the mastery medical coding certification. If you have this, you can go anywhere. This says you have mastered inpatient and outpatient coding, and it is quite incredible to get it. Okay, so I'm just saying that aside there. Let's go ahead and talk about the domains. And well, before I say that, before I get into the domains, practice with the workbooks. Okay, I have mentioned several times the ICD-10-CM and ICD-10-PCS coding handbook with the answers by Nellie Leon Chizen. The link and the description is in the description box below. Get that book and use that to practice on your ICD-10-CM coding and your ICD-10-PCS coding. It also has exercises in the back, all kinds of scenarios that you can use to practice, okay? And I'm going to keep reiterating that part, because that's the only way you're going to be able to get through this exam, because as you will see here from the domains, the coding is still quite a bit of that exam. So use that to prepare you for the ICD-10-CM part, ICD-10-PCS part. Additionally, you are going to find yourself the CPC study guide. And yes, I said CPC study guide. The CPC study guide to help you prepare for the CCS. We all use the same CPT code set. All of us. Every single coder uses the same CPT code set. AAPC did a fantastic job on that study guide. I like the way that it's broken down. I like the way that they have their answers. They have the answers to everything. They've got rationale for everything. Now, a couple of those codes I kind of disagree with, but that's okay, because for the most part, they are all, I mean, the answers are there. It's really great. So I really do recommend that. Work through that entire workbook, and that will help you prepare for the CPT part, okay? That will help you prepare for that side. So the CPC study guide, you can get the 2022 version, the 2023 version. You can get the 2021 version if you wanted to. You just need it just to practice on, okay? So that way you can work through your CPT side. And again, ICD-10-CM and ICD-10-PCS coding handbook with the answers. With the answers. Do not get the one without the answers, because how are you going to know if you got the correct answers or not? I'm just saying. So get those two books and practice with those. And that's going to give you your speed. That's going to help you develop your speed. And then you're going to know, okay, well, I know I need to work on OBGYN coding. I know I need to work on ortho coding. You're going to be able to know that working through those two books. And if you have, not an ad, I will say not an ad for anything, okay? I'm just saying. But not an ad for Optum. But if you have the Optum Spiral Bound ICD-10 PCS coding manual, in the back in Appendix M, like in Mary, they have a whole list of all these ICD-10 PCS procedures for you to look up. Go through, it's 388 of them. 388 of them you need to work through. And trust me, if you do all those three things, oh, you will be ready. You will totally be ready for the coding side. And again, that's your bulk right there. So if we can get that bulk side down, if we can get all of those, finding the codes, looking up the codes, getting speed with the book, if you can get there, then you are halfway there, okay? You're halfway there, because the rest of it, I'm going to tell you right now, the rest of these domains, I'm going to tell y'all where to look, okay? I'm telling you where to look in this video. I may or may not leave links, but for the most part, there's a lot of information in the description box below. Guys, you have to start learning to do your research, period. You have to, because a lot of you are trying to do this spoon feeding thing again. And guys, I don't do that. I do not spoon feed, okay? I'm just saying. So here we go. Domain 1, coding knowledge and skills. This is starting May 1st. And I will also say this. Okay, one more thing. One more thing, I promise. It's going to go into the beta period beginning May 1st. Beta period means that when you go into Pearson VUE and you're sitting for the CCS exam, when you complete your exam, you will not be given an immediate test result, okay? Normally, when you go in and you test and it's not in a beta period, you will receive your results right away, but not May 1st. May 1st, 2024, it is going to be in the beta period. So until a certain number of people takes the exam nationwide, right? Worldwide, nationwide, whatever. But a certain number of people take this exam, then they will release the scores. And this can take up to 6 months. So just saying, be prepared for a wait. Now, if you want to kind of wait a little bit and let other people take the test, it depends on how fast they release that beta period, okay? So it may be a month, it may be 2 months. People were saying that the RHIA, which just came out of the beta period, it was going to be a while. Oh, it was going to be a while. No, contraire, no. They were out of the beta period quite quickly. So, you know, it really all depends on you. So just depending, okay? But if you go to the Ahima website, ahima.org, ahima.org, it will let you know if the beta period is over or if it is still in the beta period, okay? So now, starting May 1st, the coding knowledge and skills is 39 to 41% of this exam. 39 to 41% of this exam. This is the bulk of this exam, okay? So basically what is going over is assigning diagnosis and procedure codes based on the provider's documentation in the health record, identify principal first listed diagnosis and procedures based on the respective guidelines. This is another thing that I'll tell y'all too. Read the coding guidelines in their entirety once per week. They're in your ICD-10-CM manual. You have to learn to read those in their entirety once per week because you're not trying to memorize, but what you're trying to do is practice on your reading speed, guys. Practice that reading speed because I can't tell you how many heartbreaking stories I've heard from people who write to me upset and say, Blue, I ran out of time. I overthought, I read too slow, I panicked. Learn to read and read quickly, okay? Practice with those guidelines. I'm just telling you, okay? So then apply coding conventions and guidelines. And every person that I've ever told to read those coding guidelines who actually listened, they come back to me and they say, Blue, thank God I listened because I did it. And it was because I read those coding guidelines. Attach CPT and HCPCS modifiers to outpatient procedures. Determine appropriate sequencing of diagnoses and procedure codes based on the case scenario. Assign present on admission guidelines, or apply rather present on admission guidelines. Demonstrate knowledge of coding edits, NCCI, and medical necessity. Demonstrate knowledge of reimbursement methodologies, DRG, and APCs. Abstract applicable data from the health record, and then identify major comorbidity conditions, MCCs, and comorbid conditions, CCs. Domain 2 is coding documentation, that is 18 to 22%. Resolve conflicting documentation in the health record, admission type, laterality. Ensure all documentation for assigned. Ensure all required documentation for assigning a specific code is available within the body of the health record. Verify and validate documentation within the health record. Then domain 3 is provider queries. That's 9 to 11%. Identify elements of an ethical compliant query. Determine if a provider query is compliant, like non-leading, contains appropriate clinical indicators, and then analyze current documentation to identify query opportunities. Domain 4 is regulatory compliance, and that's your other heavy hitter. That's the one that's 18 to 22%. So ensure completeness and accuracy of health records, understand payer-specific guidelines, identify patient safety indicators and hospital-acquired conditions based on the provider's documentation, ensure compliance with HIPAA guidelines, ensure adherence to Ahima standards of ethical coding, and then ensure compliance with the UHDDS. And then domain 5 is the information technologies. That's 9 to 11%. That is going to be distinguish various types of EHR, demonstrate a basic understanding of encoding and grouper software, exhibit an understanding of computer-assisted coding software and its impact on coding, and then ensure compliant with high-tech guidelines. And then the medical scenarios, inpatient is 33.3%, outpatient is 33.3%, and emergency department is 33.3%. So those are the ones that you have to know for your medical coding, your medical scenarios. Okay, medical coding, medical scenarios. But I want to go back a little bit to the coding domain 2 and domain 3, right? The coding documentation and the provider queries. You know, Ahima has a lot of papers on their website that you can access. If you are a member, you get access to more things. But if you Google, you can have access to some of these papers. So always look up things like that. There's a paper about the compliant query. You want to read that, okay? And that's going to cover like your coding documentation as well. There's also the Ahima standards of ethical coding, and you want to read those, guys. So there's a lot of public information and there's member-only information. So just make sure that you check out what is free and available through Ahima that you can read. But it's all right here, guys. And then for this regulatory compliance, HIPAA guidelines can be found. I want to sneeze so bad. HIPAA guidelines can be found on the CMS website, cms.gov. If you go into the little, like the little spyglass, the magnifying glass, you can put in HIPAA and all the things about HIPAA will come up. All the things about UHDDS will come up as well. That's the Uniform Hospital Discharge Data Set. You can actually Google that as well, and you'll find lots of links that will come up with information about that. So, and then it says, of course, adhere to the Ahima standards of ethical coding. It's there on the website so that you can read that, so that way you have that in your mind, what they are and what does it cover and what do they do in certain situations, okay? And then as far as like the computer assisted software and its impact on coding, high tech, all of this again can be found just by a simple Google search, okay? This is very easy to do. All you have to do is just plug this in to Google and it will bring up lots of references that you can read on your own. It is unnecessary to spend all this money trying to find all of these things that are going to help you when you can easily do your own research and you can easily access these things on the internet for free. And then you can take your time and look at them, okay? So that's what I would recommend for you if you're going to be studying for the CCS exam. Practice, 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 practice. Practice looking up those codes, because the more time you spend with your books and practicing, the better off you will be, okay? This is not a waste of time. It is an investment of your time so that you can ensure your confidence, so that you can ensure a good result from when you take the exam, okay? I've been there. I know what it's like. I know how nerve-wracking exams can be. I've taken 3 with Ahima, the CCA, the CCSP, and the CCS. Now, when I got the CCSP, the CCA was superseded, okay? And then from there, I got my CCS. So I still carry both the CCSP and the CCS because it's just me. But what I would recommend for you when you're out there preparing for the CCS is that you need to take the time to practice, practice, practice. You have to be studying 20 hours per week. I tell you guys this all the time. And yes, you can make time. It does not matter if you have a family and kids and all these things you have to do. There's pockets of time that you can invest in listening to the guidelines. You can listen to the coding guidelines. If you watch my channel, I've already explained it several times how to listen to the guidelines. But you can go to cms.gov. You can download the ICD-10-CM, the 2024 guidelines for free, and you can be able to listen to them. So listen to them, and you can practice reading them, obviously, if you have the book. And you can spend 30 minutes here looking up codes, 30 minutes there, an hour here, an hour there. If you have time to scroll and go through Facebook and TikTok and all these other things, and you have time to be gabbing on the phone, you have the time to be practicing with your studies, okay? 30 minutes minimum and 1 hour maximum. You can do this, guys. You can invest this time. I've said, I've done a whole video about breaking down the hours. If you're driving to work, you can be listening to something. Not just the coding. You can listen to anatomy videos. You can listen to medical terminology videos. You can listen to HIPAA training videos, right? Because they have those all over YouTube. So you can listen to those on your drive to work. Okay, so you got 30 minutes drive to work. You got 30 minutes for lunch. You can still listen, right, while you eat. Or you can do flashcards, right? And then when you're driving home, that's another 30 minutes. That's an hour and a half you've already spent studying, okay? Because you're making good use of your time. You're being intentional with the use of your time. Then when you get home, right, and you've made dinner for the kids and you've done everything that you need to do, right, you just need another hour and a half to squirrel in. And that's going to make 3 hours, right? But if you did 2 more hours, that's going to give you 3.5 hours done in one day. So if you do 1 hour and then you take a break, let's just say you got everything ready and you did all the things for, making dinner and stuff like that, and it's 7 o'clock and everybody's, looking at the TV and stuff like that, and they want you to be in there in the room, then you can have your book there with you. And you can be going through your book. You can be there in the room with everybody. You can have your headphones on and you can be looking through your book, okay? So that way you can still be present with your family. And that's 1 hour. Then you take a break because you need to have your brain have some kind of peace. And then you come back to it, and that's another hour. Guess what? That's 3.5 hours that you did in one day. 3.5 hours you did in one day. And you do that for 5 days. That's 17.5 hours that you've managed to squirrel in of coding, of looking at the books, of flipping through the pages and getting familiar, of listening to something. 17.5 hours. And then all you need is 2.5 hours on the weekend, on a Saturday or Sunday. 2.5. And that will give you a full 20 hours. And then you do it all over again. And then guess what? That 20 hours still gives you plenty of time to be with your family on the weekend, to be able to do whatever it is that you need to do, because there's no excuse for not studying, guys. There's none, especially when I've just laid it out for you. 3.5 hours a day. Add it up, 17.5 hours, 2.5 hours on the weekend, and then boom, you're done. And you do this consistently for the time that you're preparing for your exam or while you're in school, you've got it. You've got it. And it will make sense. But it's not going to make sense if you're going to sit here and fight against it and, oh no, I don't do that and I'm so tired and blah, blah, blah. Excuses. Excuses. And that's not for you. It's not for you. Because why? You want something better for yourself. That's why you chose this career field. Because you want something better for yourself. Well, then you need to put in the work. And that's actually putting in the work. So take the time to find your resources on cms.gov. Go to ahima.org and look around at all the articles that they have there. Google the Ahima Standards of Ethical Coding. Google high tech. Google all of these things, UHDDS. It's going to give you everything that you need to know. And the more you read, the more you listen. Look on YouTube. YouTube also talks about UHDDS. YouTube also talks about high tech. All you have to do is put that in there and you can listen to those videos. Come on, guys. I'm just saying. So, with that said, best of luck to you if you're taking your exam at any time, but mostly if you're taking that 2024 exam, because that's going to be new. It's a new layout of that exam. So, best of luck to you guys. You can do it. Put in the time, put in the work, and you can do it. I'm just saying. So, with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.